Hi, I'm Dr. Courtney Tracy. I'm known on the internet as the Truth Doctor, and today I'm going to be giving you all of the secrets behind what your therapist is writing in their notebook when you're in session. As a therapist, I have written so many notes, but better yet, I also spent 7 years as a clinical note reviewer in the utilization review department, looking at other therapists' notes, gathering data from those notes, and then giving the information to insurance companies to try to ask for your sessions with your therapist to be covered. So I know a lot about notes. While there are so many different types of notes that can be written by so many different types of mental health professionals, there are some very important aspects of the session that are noted almost every time. First, we're putting down the external aspects of the session that we need to remember. And this is also the information that's much more easily achieved by other people that are requesting that information. And this is known as the client record. The client record, or the client log, includes things like the date and time, your full name, date of birth, the length of the sessions, your diagnoses, if any, treatment plans and interventions, and possibly the location of the services. So again, these are all things that don't actually give personal information about what's going on in the session, only when the session occurred and other demographical details. Next, there are more detailed notes, which are sometimes called progress notes, psychotherapy notes, process notes, or therapy notes. And here we're writing down what's actually happening in session so that we can remember how to help you the best that we can. And listen, not every therapist needs to take notes in session, and some don't. This doesn't mean that your therapist is a bad therapist. It just means that they have other circumstances that allow them to just remember what's coming up for you. Typically, therapists use 4 different sections to list out their most detailed notes. Let's go over them. The first section is the subjective section. And here we're writing down what the subject, you, says during the session. What are your viewpoints, your thoughts and feelings? What is it that you're saying is going on for you? And what is it that you want help with? The next section is the objective section. And here we are writing down what we observe about you in session. Some of those things include your appearance, only for us to look at signs of possible symptoms, your movements, your speech, your mood and affect, your affect, which is how you're presenting your mood, your level of insight and judgment, your type of thinking, and also your perception of the world. The third section is the assessment section. And in this section, what we're doing is we are assessing a combination of the subjective and the objective outcomes in relation to the goals and objectives that we've created together on your treatment plan. How are you subjectively reaching your goals? How do I feel, or how does your therapist feel that you are objectively reaching your goals? What was presented in this session that indicates and relates to past sessions or informs what future sessions should look like? This is sort of where we're compiling what it is that we want and should do next and why. And the last section is the actual plan. Here we are determining the best course of action based off of what we learned in this session. And here we're prepping for future sessions to ensure that you are on your way towards meeting the goals that you've set for yourself. A final important note is to know that you legally can access your records at any time from any provider that has ever written a note about you. You can ask for your client record, your diagnoses, your assessments, and the outcomes of them, treatment plans, and intervention notes. When it comes to psychotherapy and progress notes, however, your providers do have the right to refuse access only if and when they feel that if they showed you these notes, it could cause psychological or physical harm to you or somebody else. To summarize, all therapists can and likely do have notes that look very different. There is some information that can be more easily shared, like the details of the session, the date and time, and the location, and then the more intimate and detailed notes that include the subjective, objective, assessment, and plan are things that are significantly more confidential and are the second and latter half of these types of notes. Therapists are here to help you. Our notes help make us better clinicians, and most therapists in most situations would be very happy to show you what they wrote down. They may just want to ask why you want to see it first. Sometimes it's not always the best idea to see ourselves written in third person. And also when it comes to insurance companies, often we have to write down the things that are making it so that you need treatment. We may have a million things in our mind about things that you're doing right, but sometimes insurance companies don't want to see that type of information. And at times, seeing these notes can be very overwhelming because it can just be a reminder of the difficulties of your past when what you really want to focus on are your goals for the future. Thanks so much for watching. I hope that this video was helpful. Please remember to like this video, comment your thoughts below, subscribe so that you can see me again, and hit the bell for notifications so that you don't miss out on any of my new videos. See you next time.